If you're trying to conceive, the days before your expected period can be one of the most confusing parts of the cycle. You might notice cramps, breast tenderness, fatigue, or mood changes, and suddenly start wondering, is this pregnancy? Or is my period about to start? The truth is that early pregnancy symptoms and premenstrual symptoms can feel almost identical. Many people experience the same physical sensations, whether a period is coming or a pregnancy is beginning. Today, we're going to break down the key differences between pregnancy symptoms and PMS, so you can better understand what your body may be telling you. Why pregnancy symptoms and PMS feel so similar. Both PMS and early pregnancy happen during the same phase of your menstrual cycle, called the luteal phase. This phase begins right after ovulation. During the luteal phase, your body produces a hormone called progesterone. Progesterone prepares the uterus for a possible pregnancy, but it also causes many of the symptoms people notice before their period. These include breast tenderness, bloating, fatigue, mild cramping, and mood changes. Because progesterone is present in both situations, many of the symptoms overlap. This is why it can be very difficult to tell the difference between PMS and early pregnancy just by how you feel. However, some patterns and timing differences can provide helpful clues. Cramping. Mild cramping is very common before a period. These cramps happen because the uterus is preparing to shed its lining. PMS cramps often become stronger as your period gets closer, and they may continue during the first few days of menstruation. Early pregnancy can also cause mild cramping. These cramps are usually gentle and feel like a light pulling sensation in the lower abdomen. The key difference is intensity. Pregnancy-related cramps usually remain mild and do not gradually increase like menstrual cramps often do. Breast changes. Breast tenderness is another symptom shared by both PMS and early pregnancy. Before a period, hormonal changes can make the breasts feel swollen or sore. This discomfort often fades once menstruation begins. In early pregnancy, breast changes may feel slightly different. Breasts may feel heavier or fuller than usual. Nipples may also become more sensitive. Some people notice that the area around the nipples becomes darker as blood flow increases. Another difference is how long the tenderness lasts. If breast sensitivity continues beyond the time your period is expected, pregnancy becomes more likely. Fatigue. Feeling tired before your period is normal. Progesterone can make the body feel slower and more relaxed, which sometimes leads to sleepiness. However, fatigue in early pregnancy can feel more intense. Many people describe it as an unusual level of tiredness that does not improve with rest. This happens because the body is adjusting to hormonal changes and beginning the work of supporting early pregnancy. Bloating. Bloating is one of the most common PMS symptoms. Hormones can slow digestion and cause the stomach to feel swollen or full. This bloating often improves once the period begins. Early pregnancy can also cause bloating because similar hormonal changes affect digestion. Because both PMS and pregnancy can cause bloating, this symptom alone cannot reliably distinguish between the two. Mood changes. Hormonal fluctuations can strongly influence emotions. During PMS, some people experience irritability, anxiety, or emotional sensitivity. These mood changes usually disappear once the period starts. In early pregnancy, emotional changes may also occur. However, they may feel more persistent rather than disappearing after a few days. Still, emotions alone are not a reliable indicator of pregnancy. They simply reflect hormonal changes happening inside the body. Spotting. Spotting can sometimes provide a helpful clue. Before a period, some people notice light spotting as hormone levels begin to fall. Menstrual bleeding typically becomes heavier within a day or two. In early pregnancy, some individuals experience implantation spotting. This type of spotting is usually very light and may appear pink or brown. It typically lasts a short time and does not develop into a heavier flow like a period. However, not everyone experiences implantation spotting, so its absence does not rule out pregnancy. Nausea. Nausea is more strongly associated with pregnancy than PMS. It usually appears a little later once pregnancy hormones start increasing. This symptom may begin around the time of a missed period or shortly afterward. Feeling nauseous without another clear cause can sometimes be an early indicator of pregnancy. Changes in discharge. Hormonal changes can also affect vaginal discharge. Before a period, discharge may decrease or become thicker. During early pregnancy, some people notice an increase in creamy white discharge. This is caused by rising estrogen levels and increased blood flow in the reproductive system. As long as the discharge has no strong odor and does not cause irritation, it is usually normal. The biggest clue is timing. One of the most important differences between PMS and pregnancy is timing. PMS symptoms usually disappear once menstruation begins. Pregnancy symptoms often continue and may gradually increase if pregnancy hormones continue rising. If symptoms continue but your period does not start, it may be time to consider taking a pregnancy test. When to take a pregnancy test? Pregnancy tests detect the hormone HCG. This hormone begins increasing after implantation occurs. Testing too early can produce a negative result even if pregnancy has started. For the most reliable result, it is usually best to test after your expected period date or about 12 to 14 days after ovulation. It's completely normal to pay close attention to your body during the days leading up to your period, especially if you're hoping to conceive. However, the body produces many similar symptoms during every menstrual cycle. Some cycles may feel different from others, even when pregnancy is not present. The most reliable way to confirm pregnancy is through a missed period followed by a positive pregnancy test. Until then, understanding the similarities and differences between PMS and early pregnancy can help you navigate the waiting period with more clarity and less stress. Your body is constantly responding to hormonal changes, and learning these patterns can make the journey of trying to conceive feel a little easier to understand.